start? Or what? All right, media, we're ready to go. Are you going to put one down? Oh, thank you. All right, good morning. I'm Travis County Judge Andy Brown. Thank you very much for joining us today. Joined here with Congressman Lloyd Doggett, Travis County Medical Examiner Dr. Keith Pinkard, Austin Travis County EMS Chief Robert Lukritz, Dr. Nicholas Yagoda, Interim Chief Executive Officer of Community Care, and Maggie Luna, the Executive Director of the Texas Harm Reduction Alliance, as well as Commissioner Ann Howard, back over there. Sorry. All right, so I first just want to thank the incredible team in our Health and Human Services Department here at Travis County for all the work that they do to implement Travis County's overdose prevention programs. Their efforts save lives, and today's announcement is yet another testament to their dedication to our community, so thank you very much. They applied for and secured a $1.6 million grant from the Bureau of Justice Assistance. It's no small feat to apply. I don't know if y'all have ever seen any of the applications that they have to write for those things, but it was very thorough. And it wouldn't have been possible without the expertise, determination, and leadership of our amazing team led by County Executive Pilar Sanchez. I also want to thank Congressman Lloyd Doggett, who has been an amazing advocate for our community for so many years, consistently fighting to bring critical resources to Travis County to help us address this opioid epidemic that we're in the middle of. Your leadership, Congressman, and your partnership have been instrumental in helping us confront this crisis head on. The $1.6 million grant award under the Comprehensive Opioid Stimulant and Substance Use Site-Based Program is a transformative opportunity for Travis County. And with these funds, we're going to be able to launch the jail-based substance use intake program, which will expand access to harm reduction strategies and evidence-based treatments, including medication-assisted treatment, and also to provide holistic support for those transitioning back into our community after they've been in jail. The program's more than just about treatment. It's also about creating a pathway to recovery and ensuring a continuum of care that will help break the cycle of substance use and incarceration. And we know from a report released by our Travis County team last year that people leaving the jail are 8 times more likely to die of an overdose in the first 6 months after they leave jail than people in the community in general. And a lot of that is due to the fact that they didn't have this opportunity that the congressman and others have allowed us to have. If you're completely off of opioids while you're in jail, your tolerance changes, and then you're much more likely to overdose. And so that's, I think, why we're seeing that statistic. This grant is going to help us focus our prevention efforts on a population that's at greatest risk for dying, which is what this work is all about, saving lives. I'm also here today, along with Dr. Pinkard and others working in this area, to share some encouraging news. I don't know if less bad news is necessarily good news, but it is definitely a better trend than we have seen in years past. For the first time in 3 years, we're seeing a decline in overdose deaths here in Travis County. Thanks to the Travis County Medical Examiner, Dr. Keith Pinkard, we have some preliminary data from the first 6 months of this year that tracks the overdose deaths, and he's going to get more in depth into what that says. But the highlights are in 2023, we had 486 total overdose deaths, and 250 of those occurred in the first 6 months of 2023. This year, in the first 6 months, we've seen 221 deaths. So that is a decrease from 250 in the same period last year. And I think Dr. Pinkard will have better numbers on that when he gets up here. Even one death is still too many, but we need to take a moment to recognize that investing in people and resources and Narcan and things like that are starting, hopefully, to make a difference. Last year, therefore, marked the peak of this crisis that we've seen here in Travis County, but thanks to the dedicated and collaborative work of so many people that you see up here today and some people that are not here today, we're finally beginning to see promising results from our joint efforts. However, we are still very far away from winning the battle against this crisis. Overdoses are still the #1 cause of accidental death here in Travis County. And overdose deaths still remain above the levels we saw 2 or 3 years ago. But this progress shows that our collaborative efforts, whether it's increasing access to Narcan or naloxone, expanding treatment options, launching innovative programs like the one we're announcing here today, are having some real impacts here in Travis County. We must continue to work together to fight overdoses, to get more people receiving treatment, to help people recover and transition back into our community. So thanks again for being here today. Thanks for your partnership. And now I'll pass it on to Congressman Lloyd Doggett. Thank you.
Well, thank you, Judge. And I think we do have a real partnership here between the federal government and Travis County in trying to address this crisis. I appreciate the role that each of the participants in this morning's event provide, the services that they provide our community, and the fact that Judge Brown, Commissioner Howard, and this Commissioner's Court have made a priority addressing the opioid crisis. They did so, in fact, 2 years ago by declaring the public health emergency that continues associated with opioids. Overcoming this crisis does require all of us in partnership, the county, the city, the school district, and the federal government. I wish we had a little more help from the state of Texas, but we need them also. And while this troubling problem is most apparent with some of the most vulnerable people in our community, that's what we often hear about in connection with opioid abuse, it is community-wide, as the Commissioner's Court recognized in declaring this emergency. Might well be someone who's undergone a medical procedure and has become hooked on opioids and then goes to add to, as they lose their prescriptions, to seek other sources and face great challenges and risk to their health. I am pleased to formally announce the $1.6 million that we've secured in additional federal funds to support the county in this effort in delivering comprehensive care to some of the individuals that are battling substance abuse through our jail systems and continue as they are reintegrated in our community. This is a much-needed lifeline for those that are very much at risk. These funds build upon federal funding that we previously announced together, $2 million that I secured in a direct appropriation for our county on securing Narcan and prevention and education services, as well as another $1 million that we obtained for recovery services and peer support pilot programs in the emergency department and the Travis County Civil and Criminal Drug Courts. Together, I believe we are expanding step-by-step access to treatment and providing help to some of those that are most in need. But as the judge said, there is much more that needs to be done. While we've seen some bipartisan support in Congress and in the Texas legislature for supporting fentanyl testing strips, we've never made it past the legislative line in either forum. And we need in Congress and in the Texas legislature that's about to convene approval to make these fentanyl testing strips readily available and legal. I remain committed to working with the Commissioner's Court and others in our community, like those here today, to try to save lives, support recovery, and make our community healthier for everyone. I want to thank especially the healthcare professionals who we're about to hear from, because they're out there on a day-in, day-out basis dealing with some really tough situations. And I think now we can learn more about the toll and the slight improvement that we've had from our county medical examiner, Dr. Keith Pinkard. Dr. Pinkard.
Thank you, Congressman. I'm Dr. Keith Pinkard, Chief Medical Examiner for Travis County. The Medical Examiner's Office's function is to investigate and certify causes and manners of death in cases that fall under our jurisdiction. Accidental drug overdose cases are certainly part of that jurisdiction. And I'd also like to point out that the Medical Examiner's Office, in performing its role by tracking statistics of a number of causes and manners of death, also performs a de facto public health role. And as an example of that is the data that I'll be sharing with you this morning. The data I'll be discussing is from January through July, inclusive of 2024. And so when I give numbers in comparison to previous years, that's comparing the same time period, January through July, of those past years, going back to 2020. So I'd like to start by saying that in 2020, during this time period, we had 17 deaths due to drugs that involve fentanyl and 141 accidental drug deaths overall. Those numbers for both of those categories increased annually between 2020 and 2021, 21 and 22, and 2022 and 2023. Of particular note, 2021 was the year in which accidental drug overdose deaths overtook motor vehicle collision deaths to become the #1 type of accidental death occurring in Travis County. And in each of those years, there was a dramatic increase in the number of both fentanyl-involved drug overdoses as well as drug overdoses overall, regardless of the drug. I'm pleased to report that in the first 7 months of 2024, we have decreases in both of those categories. We saw a 19% decrease in accidental drug deaths overall and a 26% decrease in accidental drug dose involving fentanyl between, again, those 7 months in 2023 and those corresponding months in 2024. So I think in several years, those are the most encouraging results we've seen, although, as Judge Brown said, less bad news. But I think we've certainly turning a corner in that around 20% we're 20% less drug deaths than we saw last year. Looking at those numbers more specifically, we are about right now back at the same or equivalent numbers as we saw roughly 2 years ago in 2022, and hopefully this downward trend will continue through the rest of the year and in future years. Thank you.
Thank you, Doctor.
Good morning. My name is Rob Lukritz. I'm the Chief of Austin Travis County EMS. First off, I would like to thank Judge Brown for the invitation to join you here today, as well as the other distinguished guests, Congressman Doggett, Dr. Pinkard, Dr. Yagoda, and the Texas Harm Reduction Alliance. First and foremost, I'd like to thank the county, Judge Brown, Commissioner Howard, and the entire Commissioner's Court for their leadership when it comes to combating the opioid crisis in our community. Earlier this year, our community was rocked by a surge in opioid overdoses that affected hundreds of patients and resulted in 9 deaths. Had it not been for the foresight and support of our county and city leadership in combating the opiate crisis, I am certain the death toll would have been much higher. I also want to be sure to thank all of the community members that worked so hard to address that surge, including the numerous community health paramedics and other members of the ATC EMS family that immediately responded and assisted those most in need. Yet we stand here today as Dr. Pinkard has announced the news that despite the overdose surge earlier this year, 2024 has seen an overall decrease in the amount of overdose deaths in Travis County. This means that what we're doing is working. Harm reduction is working. Education is working. Austin Travis County EMS has been on the front lines of the opiate epidemic since it began and has been leading the way in proactive opiate overdose response. We respond to thousands of overdoses each year, which means that our medics are often the first point of contact for individuals struggling with opiate use disorder. Our community health paramedics are following up with every overdose in our system, offering patients and their families naloxone or Narcan kits, prevention education, and treatment options, including our buprenorphine bridge program. We recently expanded our naloxone kit program thanks to the continued funding from the opiate settlement. And as of late last week, every single ambulance in the Austin Travis County EMS system now carries a stock of Narcan or naloxone rescue kits that medics can distribute to any member of the community who is at risk for overdose or who may be in a situation where they encounter someone who has experienced an overdose. In 2023, we launched our Breathe Now training, which is a short course that teaches community members to recognize the signs of an overdose, how to administer naloxone or Narcan, and how to care for victims until help arrives. The impact of increased availability of Narcan and naloxone, as well as overdose education in our community, has led to a measurable reduction in overdose deaths that has been discussed here today. I'd like to extend my deepest gratitude towards all the men and women of the Austin Travis County EMS family, our harm reduction partners, and the entire Austin and Travis County community who are working so hard every day to minimize the impact of the opiate crisis in our community. We are doing better at saving lives. We are changing lives each and every day here in Austin and Travis County. And with that, I'm going to hand the microphone off to Dr. Nicholas Yagoda, the interim CEO of Community Care.
Thank you and good morning. Today marks a significant step forward in our effort to address a crisis of opioid deaths in Travis County. This $1.6 million federal grant will help us build a more compassionate and effective system of care for those most vulnerable members of our community. The numbers behind this crisis are staggering. In Travis County, the opioid epidemic continues to disproportionately impact marginalized communities. From 2020 to 2022, fatal overdose rates among Black residents rose by 66%. Hispanic residents experienced a 96% increase in overdose deaths. And for white residents, that rate increased by 32%. While recent data show important improvements, and we're grateful to receive any good news, these statistics only tell part of the story. At Community Care, we see the human toll of this crisis every day. We hear patients share their grief for loved ones lost to overdose. During pediatric visits, we see children whose futures are shaped by the absence of a parent struggling with addiction or incarceration. The toll echoes in the silence of missed appointments, where instead of celebrating a patient's cured Hep C, our teams learn their patients were sent back to jail, the cycle of risk to begin again. Our patients disproportionately bear the weight of this crisis, yet they do so with incredible resilience, with aspirations intact, aspirations for survival, for thriving, reclaiming their health and their stability. These stories underscore the urgency and importance of our work to bridge gaps and create a pathway to recovery. Community Care is committed to the transformation needed to halt this epidemic. Guided by lived experience and evidence-based practice, we offer integrated physical, mental, and substance use treatment, including wraparound support for housing and peer support services, regardless of one's ability to pay. In 2022, over 600 patients with opioid use disorder sought care through our specialty addiction medicine clinic, where our retention rates are at 76% after 1 month and 50% at 6 months, nearly double the national average. This year, we expanded services to support more than 8,000 patients with different substance use disorders, offering rapid access to addiction medicine expertise, advanced primary care and life-saving medications like naloxone used for overdose prevention. In early 2025, we will open a new addiction medicine clinic at Capitol Plaza, continuing our mission to close gaps in care and address health disparities across Travis County. But we recognize along the continuum of one's recovery, some of the most crucial moments occur outside our clinics. The transition out of incarceration is one of the most vulnerable and dangerous times for individuals with substance use disorders. Without immediate access to health care during this transition, the risk of a relapse and fatal overdose skyrockets. Yet patients on medications for opioid use disorders have half the risk of dying from any cause. Our system of care must support continuous access to these life-saving medications. That's why this grant is so important. It allows us to ensure that people leaving jail have access to the care they need to recover and rebuild their lives. Working alongside the Travis County Jail Team and additionally leveraging our mobile and healthcare for the homeless programs, Community Care Substance Use Program will provide continuity of care and reduce systematic barriers to recovery. Notably, this work is not possible without partnership. Community Care's Wellness and Holistic Addiction Medicine Clinic collaborates with community organizations like Communities for Recovery, Texas Harm Reduction Alliance, Integral Care, Central Health, Travis County, the City of Austin, Dell Medical School, Del Seton Medical Center, and among many others, to deliver integrated, low-barrier services. Today, we recommit ourselves to the shared vision of a healthier, more equitable community. By working together, we can save lives, support recovery, and give every individual the opportunity to thrive. Thank you to all who are here to honor this great day. We look forward to your questions. Oh, forgive me.
Hello, everyone. My name is Maggie Luna. I am the Executive Director at Texas Harm Reduction Alliance. And, excuse me, I'm also somebody who spent 20 years actively addicted to opiates and living just like the people that we serve today. And so this work is very important to me because I could be one of those numbers. So I want to also talk about what harm reduction is. And what we do is we provide a service. I'm sorry. We provide evidence-based strategies by going into the community and providing opioid education and overdose prevention, Narcan, and dignity to people who are living on opiates. We are also actively inside of Travis County Jail. We have a harm reduction reentry team that goes inside Travis County and teaches financial literacy, harm reduction, and talks about the potency that you know may not be what you come out to. And so it's important to know and educate yourself on what may be out in the streets. And so it's very important to us to continue this work and really appreciate the work that's being done in the county to help this population, because there's so many people who all you need is dignity and somebody to talk to, and that will help provide you a pathway to whatever positive change you would like. And so I am someone today who has 8 years without opiates, and I every single day see people who overdose is preventable. We should not have overdose deaths. And as much Narcan and education we can get out, those are more people that we can save. And so, yes, that's what we do at Texas Harm Reduction Alliance. We are hoping to continue this partnership, and we appreciate everything that the county is doing to help. Thank you.
Thanks, Maggie. Before we open up to questions, I had a part in Spanish that I'll read. Hoy celebramos un logro significativo, la obtención de una concesión de 1.6 millones de dólares para implementar un programa innovador en el sistema carcelario que ampliará el acceso a tratamientos enfocados en salvar vidas y combatir la crisis de sobredosis en nuestra comunidad. Gracias al trabajo dedicado y colaborativo de muchos, estamos comenzando a ver una disminución en los muertos por sobredosis aquí en el condado de Travis. Un avance prometedor que refleja el impacto de nuestras inversiones en personas y recursos. Thank you. So now, are you saying anything? No? Okay, so I'd love to open it up to questions.
Okay. Se había tratado de obtener este recurso. We tried to obtain these resources a long time ago. What it refers to the Travis County get it to work on the schools, districts, because I think it's very important to work inside the schools. What partnership that you're doing with the district for the schools of Austin?
What partnerships do we have with like AISD and Del Valle and other places? I know that that's a very good question. I need to get back to you on details of that. I do know that we worked with them in the past to get Narcan on campuses. I believe that is in place today, and I don't know if any of y'all know any more details about that than I do, but that's a great question. Thank you very much.
We've got some of the program highlights here. Can you run through what those are and how you all decided that that's what you all were going to focus on within this program?
On this particular grant, do you want to talk anything about the specific grant?
I think you have
Okay.
the specific number of people that are, what you're going to do with those dollars.
Okay. Let's see. So we're going to launch, what this is the jail-based substance use intake program, and it will expand access to the strategies that Maggie outlined and that others have outlined up here relating to harm reduction in the jail. It'll include medicated assisted treatment and providing holistic support for those transitioning back into our community. And so one of the big reasons why this is so important is that that statistic that Maggie kind of talked about is when people are in jail, and especially if they're in jail for a longer period of time, and they're not using opioids at all, and maybe they don't have access to medically assisted treatment, their tolerance can change quite a bit. And so they get out of jail, they don't have support, and they start taking the same amount of opioids they were taking before they went into jail. That can kill them. That leads to that statistic of why they're 8 times more likely to die in those first, month or so when they get out of jail. I know that the jail is already working. They do have some medically assisted treatment in the jail, but this is going to help expand that. It's really going to help save lives. And that period of when people leave the jail is one that we identified as something that should not be in the case. And this grant is the exact thing that we need to help us save lives in that critical period after people leave the jail. Does that answer your question? Okay.
Judge, no doubt this program is working and it's showing dividends, but going after the supplier is also important. The district attorney has yet to indict anyone for supplying fentanyl. Other counties have. Hays County has. Williamson County has been aggressive going after these dealers. What's your call to the DA in regards to going after these suppliers and the dealers?
Yeah, we absolutely need to work in all aspects. What we're doing here at Travis County today with the Commissioner's Court is making sure that we're saving lives of people that are already using opioids.
But are you disappointed that the DA is not going after the dealers with the law that we have, this new law, and getting these dealers who are dealing this poison off our streets?
What I'm very excited about is this money from the federal government to help us save lives here in Travis County. That's what we're talking about today.
I can belabor this, but I'm getting to the point. We've got to get it. Don't you agree that we've got to go after the dealers?
The thing that I'm focusing on is the public health approach to this. I don't think, I think that the things that we're working on at Travis County with a mental health diversion center, with a sobering center, with harm reduction efforts, has led to this decrease in the rate of people dying of overdoses here in Travis County. So that's the thing that we're focusing on. That's what we're focusing on here at Travis County, is making sure that we have a good public health response to this.
Hey, I have a question for Dr. Pinkard. Are there more overdoses but less overdose deaths?
Dr. Pinkard.
Yes, good morning. Could you repeat that question, please?
Is Travis County seeing a higher rate of overdoses but a decline in deaths?
I can't speak to the rate of overdoses because the only cases that my office sees are the cases that cause death.
Okay.
And those deaths, in fact, are decreasing.
And just a quick follow-up to that, are y'all contributing the prevalence of Narcan to the decline in deaths? And if so, do you have any data to support Narcan decline in overdose deaths in Travis County?
I don't have any specific data regarding any of the Narcan programs. My office is not involved in that arm. I think it's certainly reasonable to conclude that the decrease in drug deaths overall in Travis County, and specifically opioids and fentanyl, are in fact due to the number of measures that have been present over the past few years.
Yes, I can say that we are seeing a decrease in the number of opiate-related emergencies here in Austin and Travis County. And we do attribute that directly to a lot of the efforts that we've been doing as an entire community in terms of harm reduction, education, Narcan outreach, medication treatment programs. It's the combination of all of those things put together that all of us here together in each and one of our individual roles, as well as our partners at Austin Public Health and elsewhere, are able to make those efforts successful.
Can I add one number?
Sure.
Texas Harm Reduction Alliance, we have data showing that from our services, there were 203 overdose reversals in 2023. So those are numbers that were just told to us or on site. And so, thank you.
And hey, part of the dilemma there is that we obviously, Dr. Pinkard knows exactly how many people die and why they die and gives us a great report of that. It's hard sometimes, like EMS knows how many people call 911 and how many people they help transport and how many lives they save. What we don't have a perfect understanding of is how many people are overdosing but never calling 911. Maggie and Texas Harm Reduction Alliance get some of that data, but we don't have a perfect system. And so we're trying to build that system. I know TexCope and the University of Texas were working on that, but what we've got here is the best data that we have to sort of track how the progress is going, but we really do need more data of people that are, overdosing and not dying, and to really understand this crisis and frankly understand what the policy is that we need to do to reduce that number even further. Yeah.
Sure.
Okay, this question, you may not answer this. I know President-elect Trump has threatened tariffs against Mexico, Canada, and China if they don't curb fentanyl smuggling. What impact do you think that could have here in Texas?
Well, I think we need to do everything we can here in Travis County, across the country, to prevent the entry of fentanyl to poison and create ill health and death for too many people. The tariff approach, I think, presents many other troubling aspects. The notion that every Texan who buys an avocado, a tomato, our fruit, will get a Trump grocery tax bill of 25% is significant. I don't think that that kind of shotgun approach is a good way to tackle this problem, but I do think we need to be supporting law enforcement at every level. It just, as the judge pointed out, and as the whole thrust of this press conference, we need law enforcement to crack down here. Saw a story yesterday about these drug gangs in Mexico recruiting chemistry students to help mix this stuff up. We need to be responding to that. I just think it is better done in a law enforcement way than using this broad brush of tariffs that will raise prices not only on groceries but many other things here. The other aspect that I would point out is if law enforcement could solve this problem alone, there'd be no need for us to be here. It is a complex problem, and it requires both a law enforcement and a public health approach, and that's why our focus today is what can we do from a public health standpoint, but that is not to suggest that the law enforcement aspect is any less important.
Are you hopeful that, in talking with that, no doubt that the efforts by the governor on the border has slowed things at the border that maybe has helped contribute what we're seeing here? But as you go back to Congress with this new administration, this new move, is this the time, do you feel, is this the time that we're actually going to get something really substantial pushed through in regards to the border, in regards to trafficking? Are you hopeful that something can be done?
I think it's very uncertain. Personally, I think Project Lone Star, or whatever it's called, that the governor's used, has wasted a significant amount of taxpayer money and produced very minimal benefits. Whether President Trump, along with the tough talk and these broad brush approaches, can help us reduce this, I certainly support any good faith effort that he has to do that, but I haven't really seen an outline of it. I've seen only a lot of tough talk about what he would do and using only as his weapon tariffs, which I think are the wrong weapon to use.
All right, folks, thank you all. If y'all need any follow-up,
Thank you.
let us know, or Jackie knows from the judge's office as well. We can get any information you need. Thank you all.
I had and left behind the list of kind of each thing that would be paid for with